Hello, folks. We are just waiting for all the reporters to enter the room. We are also, again, experiencing what are hopefully minor technical issues. So hang tight. Okay, we're going to go ahead and get started. Unfortunately, there are still some problems with the live stream, which hopefully will get rectified. But good afternoon, and thank you for joining the daily briefing on the City of Philadelphia's response to COVID-19. Today, all our speakers are again joining us virtually to adhere to social distancing guidelines. And we will begin our briefing with opening remarks from Mayor Jim Kenney. Mayor, you have the floor.
Thank you very much. Good afternoon, everyone. I begin today with some very sad news. I have to announce that another member of our city government family has perished due to this terrible disease. Because their family has asked for privacy, I will not share the individual's name. I can tell you that the individual worked for the Philadelphia Department of Prisons as a social work services manager. This is a heartbreaking reminder that the virus does not discriminate and that it is affecting people throughout our entire community. We are unsure where and how the employee contracted the virus, but we will continue to do all we can to protect the other city employees who are continuing to show up for work each day and put their own health and safety at risk. Our condolences go out to this person's family and friends and to the entire staff at our prison system at this very difficult time. I want to note today is the 1 month anniversary of when the city's stay-at-home order first took effect. The death of another city worker and almost 400 other Philadelphians who will be lost is a stark reminder that 1 month in, the threat of this virus is still very much with us here in Philadelphia and throughout the southeastern Pennsylvania. We are also certain that the order to close non-essential businesses and to stay at home have helped slow the spread of COVID-19. Last evening, as you know, Governor Wolf unveiled his plan for how Pennsylvania can eventually return to normal activities. We are still studying the plan. We're specifically working through how Philadelphia and our region can move forward under this framework. With the southeastern part of the state facing the greatest impact, it is clear a regional approach to recovery is vital. So we thank the governor and his staff for their diligence on this. We expect to have more information to share over the next week. One thing that is clear from the governor's plan, to get a green light, we need to expand testing. To that end, I'm pleased to announce some new testing sites in more neighborhoods across Philadelphia. The health department, along with the Health Federation of Philadelphia, is working with federally qualified health centers in Philadelphia to expand testing capabilities in underserved communities. Under this plan, the health department will provide testing supplies and personal protective equipment, PPE, as able to those federally qualified health centers that agree to several provisions. These include making testing available at least 3 days a week, making available to the public the phone number and or website link with relevant information for persons to understand how to schedule a test, and providing the city with regular data on the number of persons tested. Dr. Farley will have more details, and the press release that we will issue shortly will have locations of the sites that we are able to announce today. In addition to those sites, we are in the planning stages of testing sites in Kensington and Hunting Park. We are planning for implementation either next week or in early May, and we'll have more specifics on those sites when we're closer to opening. I thank all those who have been involved in making this huge expansion of testing a reality. I also want to provide an update on Septum. We thank the leadership of the Transport Workers Union Local 234 for hearing our concerns and delaying their job action. Healthcare workers and other essential staff are relying on Septum more than ever, and it's critical that we work together to ensure public transportation is accessible to those who need it. We also want to make sure that the conditions are safe for SEPTA operators and maintenance workers. We continue to be in close communication with SEPTA and the union leadership. We look forward to continuing to work together for the benefit of SEPTA employees who play a critical role in keeping essential services running. While we're on the subject of essential transportation, today marks the 5th anniversary of Indigo Bike Share here in Philadelphia. Over the past 5 years, there have been over 3.5 million rides taken on these bikes. And I count myself among those riders, and I use it for exercise and it's really terrific. Throughout the COVID-19 crisis, Indigo has continued to operate as an essential transit option for Philadelphia, serving frontline staff and others as they access critical resources. Bike share stations are located near health centers, grocery stores, pharmacies, and community food pickup sites. We know that a bike ride can be a good way to quickly get to your destination while practicing social distancing. In support of the fight against COVID-19, Indigo is offering 30-day passes at a discounted price of $5 for the first month or $2.50 if you have a Pennsylvania Access card. This is open to anyone, and all monthly pass options provide riders with unlimited one-hour rides. You can find out more about this on the Indigo website at rideindigo.com or follow #RideIndigo on social media. Indigo's local operations team has updated its procedures to help ensure the health of riders and staff. This includes regularly disinfecting high-touch areas of bikes and stations when they are serviced. Also, when I ride, I also use plastic gloves, which is a good way to avoid touching surfaces. Staying home is the best way to prevent the COVID-19. However, when you need to travel, Indigo can be a good option. We thank the staff of our program operators at Bicycle Transit Systems for keeping this vital Philadelphia program running, and our sponsors at Independence Blue Cross for standing by the city in this time of need, as they always do. While we are on this topic, I also want to share another bike resource for essential workers. Neighborhood Bike Works has launched Bikes for Neighbors, a program to match essential workers with a refurbished bike at no cost to them. To learn more about this program or apply for a bike, please visit neighborhoodbikeworks.org. That's neighborhoodbikeworks.org. And finally, I have some good news for the residents of Northeast Philadelphia who are struggling economically because of the pandemic. Beginning this coming Monday, April 27th, there will be a new city-sponsored food site in Northeast Philly. For free food boxes, visit the Vote, that's VOGT, Recreation Center at the corner of Unruh Avenue and Cottage Street on Mondays and Thursdays from 10 a.m. till noon. That's Mondays and Thursdays from 10 a.m. till noon. We have more positive news about food access for vulnerable Philadelphians. Free weekly food deliveries are available to residents who are facing food insecurity and cannot leave their homes due to a disability. This program is thanks to a partnership among Liberty Resources, Caring for Friends, and Share Food program. The program begins in May, but you can sign up today. To join, please call or text this number, 215-709-9619. It's 215-709-9619, or email food@libertyresources.org. That's food@libertyresources.org. A program representative will call back to discuss the contact-free food delivery plan that makes sense to you. During this difficult time, we remain committed to diversity and inclusion and ensuring that our response to this crisis reaches our most vulnerable populations. These two new efforts are examples of that commitment. Now I ask Dr. Farley to give us his daily update.
Thanks very much for joining. The situation with the epidemic is very similar today as it's been in the last few days, with a little bit of positive hope here. Between yesterday and today, we've had 583 new cases identified in Philadelphia residents, bringing us to a total of 11,226. Now, many of these 583, as in past days, were people who were diagnosed in a week or so ago, some number of days ago, but were not known to be Philadelphia residents at that time, have been classified now as Philadelphia residents, so they're counted in our statistics, but they're not necessarily new cases. Overall, we're seeing about the average of the number of cases we've seen in the last week or so, which means we're about level. If you want to see the overall trends, check the graph on our website, because there is a lot of fluctuation day to day. We're continuing to see clusters in a variety of congregate settings, including nursing homes and other behavioral health facilities, as well as the city's jail. Here are the numbers in the latest in the city's jail. We currently have 59 inmates with active infection, including 10 new that tested positive since yesterday, and 4 others who recovered and been removed from isolation. I do have to report, sadly, we have 20 new deaths from the coronavirus infection since yesterday, bringing us to a total of 443 total deaths. That 20 is about average for the number we've been seeing per day for the last week or so. Again, for a better sense of trends, check the graph on our website. Of those people who have died, 237 or 53% were nursing home residents. So this epidemic continues to hit nursing home residents particularly hard. And our hospitals are seeing about the same number of patients today that they were yesterday. There are 953 inpatients with coronavirus infection in Philadelphia hospitals and 1,806 in hospitals in the Southeast Pennsylvania region. Now the fact that it's about the same as yesterday is a good sign because we've seen steady increases over the past few weeks. Overall, 31% of our general beds and 26% of our intensive care unit beds are available. That's also unchanged. Hospitals, again, there's some hospitals that have plenty of vacancies, others where they're at or near capacity, and they're working with each other as necessary to transfer patients. And we have a small number of patients at the Leah Core Center. Let me talk a little bit about testing. We still are limited by the number of swabs we have to collect test samples and by laboratory capacity to run those tests and by slow turnarounds. Maybe some signs of progress in the future in those, but still our recommendations for testing have these criteria, which is healthcare workers with symptoms or people over the age of 50 with symptoms. And testing is available, has been available on a limited basis. And if you go to our website, phila.gov/COVID, you can see all the sites that have been available where you can call or go through their web link to find out exactly how to get testing at that site. However, we know that there's a lot of interest in making testing more available, particularly in neighborhoods and particularly for disadvantaged populations. So I've been working with the federally qualified health centers, community health centers in the city to make testing available. Now, the federally qualified health centers in general have been providing testing to their own patients. So what's different here is that they are agreed if we supply them with the sort of things that they need, they'll also make it available to people who have not been their patients in the past. So we're posting information today on 10 sites with phone numbers to call for where you can go to be tested and the schedules when they're available. These sites are in many different Philadelphia neighborhoods. Some of them are operating today, some of them will start operating next week. It's still, though, as far as who should be tested, it's the same criteria, healthcare workers or people over the age of 50 who have symptoms. Now, we are trying very much to increase the availability of testing through expansion of sites. We hope that we can be announcing more sites next week. Whenever we announce more sites, we'll again post them on the website. And if we can have more testing materials available to us, more laboratory capacity available to us, at some point we'll expand the criteria for testing. But we're not there yet, so we're not recommending testing for people who don't have symptoms. We're not recommending testing for young, healthy people who are otherwise healthy, who may have this infection right now. Now, expanded testing is a key part of the governor's plan, which the mayor said is something we are supportive of. We are still reviewing that plan and seeing its applicability to Philadelphia. We do think that there's more detail that needs to be put in as far as what exactly is allowed in a yellow zone and what's allowed in a green zone. But we are very much in agreement that we need to have expanded testing and contact tracing in order to be able to advance ultimately to green. Those are what you need in order to identify those smaller number of cases and make sure that they don't spread the infection to others. That expanded testing and contact tracing is going to take resources, which we're looking for now. Philadelphia, I should point out, is not close to advancing to yellow yet. Our case count is far above the criteria that they put in the plan for advancing to yellow. Overall, though, I'd say the fact that we have a level case count means that it's a sign that we're making progress. We're no longer seeing the sharp increases in cases that we were seeing in the past. Still, though, there's many cases, and there's not a clear sign yet that we're decreasing in our daily case count. So our best tool today is our social distancing. When we don't know who's positive and who isn't, you have to assume that everyone you come in contact with has the infection. So that means stay home. If you have to go out, keep your distance from people and wear a mask. All the information that I talked about earlier is on our website, www.phila.gov/COVID, or it could be COVID-19 or COVID-19. All of them get you to the same website. And if you have medical questions, 1-800-722-7112. Thanks.
Thank you, Dr. Farley. And now Armando will present the Spanish language translation of the mayor's and Dr. Farley's remarks.
Mensaje del alcalde Jim Kenney para el jueves 23 de abril del año 2020. Empiezo con una noticia muy triste. Tengo que anunciar que otro miembro de la familia de la ciudad de Filadelfia ha fallecido debido a esta terrible enfermedad. Debido a que su familia ha pedido su privacidad, no voy a poder compartir el nombre de este compañero, pero puedo decirles de que la persona trabajaba para el Departamento de las Prisiones en la ciudad de Filadelfia como gerente de servicios de trabajo. Y luego Este es un desgarrador recuerdo de que el virus sigue propagándose en nuestro ambiente, que no discrimina y que está afectando a las personas en toda nuestra comunidad. También quiero decirles que estamos seguros de que no sabemos dónde y cómo el empleado contrajo el coronavirus, pero continuaremos haciendo todo lo posible para monitorear y proteger a los trabajadores de la ciudad, que cada día desempeñan funciones esenciales y ponen en riesgo su propia vida y su seguridad para protegernos. Mis más sentidas condolencias para la familia y los amigos de este compañero y para todo el personal de nuestro sistema penitenciario en estos momentos tan difíciles. Asimismo, quiero señalar que hoy se cumple el primer mes de entrada en vigencia de la orden de permanencia en casa en la ciudad. La muerte de otro trabajador de la ciudad y de más de 400 residentes de la ciudad es un claro recordatorio de que un mes después la amenaza del virus todavía nos afecta mucho, no solo en Filadelfia, sino en todo el sureste de Pensilvania. Estamos seguros de que la orden de cerrar negocios no esenciales y de quedarse en casa ha ayudado a frenar la propagación del COVID-19 en esta pandemia. Anoche, como saben, el gobernador Wolf dio a conocer su plan sobre cómo Pensilvania puede volver a retomar sus actividades normales. Todavía estamos estudiando el plan aquí en la ciudad. Estamos trabajando específicamente en ver cómo Filadelfia y nuestra región pueden proceder en el marco de este plan. Dado que la parte sureste del estado enfrenta el mayor impacto de esta pandemia, está claro que un informe regional de recuperación es algo vital. Así que le agradecemos al gobernador y a su personal por su diligencia. Esperamos poder tener más información para compartir con ustedes la próxima semana. Pero hay una cosa que queda muy clara. En el plan del gobernador para llegar a la luz verde del semáforo, necesitamos hacer más pruebas. Con este fin, me complace anunciar algunos nuevos centros de prueba en los vecindarios de Filadelfia. El Departamento de Salud, junto con la Federación de Salud de Filadelfia, está trabajando con centros de salud calificados federalmente para expandir las capacidades de prueba en comunidades históricamente marginadas. De acuerdo a este plan, el Departamento de Salud proporcionará suministros de prueba y equipos de protección personal, PPE, en la medida de lo posible, a aquellos centros de salud calificados federalmente que acepten varias disposiciones, tales como hacer las pruebas disponibles al menos 3 días por semana y poner a disposición del público el número de teléfono y/o el enlace al sitio web con información relevante para que las personas entiendan cómo se puede programar una prueba. También el que le proporcionen a la ciudad datos regulares sobre el número de personas que han evaluado. Además de esos centros, también estamos planificando nuevos centros de prueba en Kensington y Hunting Park. Su implementación está programada para la próxima semana o para principios de mayo, y les daremos más detalles sobre esos sitios cuando estén listos para abrirse. Les agradezco a todos los que han participado para hacer realidad esta gran expansión de las pruebas en la ciudad. También quiero compartir una actualización respecto a Septum. Le agradecemos a los líderes del Sindicato de Trabajadores del Transporte Local 234 por oír nuestras inquietudes y retrasar su acción laboral. Los trabajadores de la salud y nuestros trabajadores esenciales confían en Septum más que nunca y por lo tanto es fundamental que trabajemos juntos en garantizar que el transporte público sea accesible para quienes lo necesitan. También queremos asegurarnos de que las condiciones sean seguras para ellos, para los operadores de Septa y los trabajadores de mantenimiento. Seguimos manteniendo una estrecha comunicación con Septa y con su liderazgo sindical para este propósito. Si bien estamos en el tema del transporte esencial, hoy también se cumple el 5º aniversario del sistema de bicicletas Indigo en la ciudad. En los últimos 5 años se han realizado más de 3,5 millones de viajes en estas bicicletas. A lo largo de la crisis del COVID-19, Indigo ha continuado operando como una opción de transporte esencial para Filadelfia. Las estaciones de bicicletas compartidas están ubicadas cerca de centros de salud, supermercados, farmacias y centros comunitarios de recolección de alimentos. Sabemos que un paseo en bicicleta puede ser una buena manera de llegar rápidamente a su destino mientras se practica el distanciamiento social. En apoyo de la lucha contra el COVID-19, Indigo está ofreciendo pases de 30 días a un precio con un descuento de $5 durante el primer mes o $2.50 si tiene ya una tarjeta de acceso. Indigo está disponible para cualquier persona y hay que recordar que todas las opciones de pases mensuales incluye viajes ilimitados de 1 hora para los pasajeros. Usted puede encontrar más información sobre esto en el sitio web de Indigo en rideindigo.com o seguir al hashtag #RideIndigo en las redes sociales. El equipo de operaciones locales de Indigo ha actualizado sus procedimientos para ayudar a garantizar la salud de los pasajeros y del personal. Esto incluye desinfectar regularmente las áreas de alto contacto de las bicicletas y las estaciones cuando reciben servicio. Pero quedarse en casa es la mejor manera de prevenir la propagación del COVID-19. Sin embargo, cuando necesite viajar, Indigo puede ser una muy buena opción. Y finalmente, tengo buenas noticias para los residentes del noreste de la ciudad que han sido afectados económicamente debido a la pandemia. A partir del próximo lunes 27 de abril, habrá un nuevo sitio de alimentos respaldado por la ciudad en el noreste de Filadelfia. Para obtener cajas de comida gratis, visite el centro de recreación Bocht en la esquina de la avenida Unruh y la calle Cottage, los lunes y jueves de 10 de la mañana al mediodía. Tenemos también más noticias positivas sobre el acceso a los alimentos para los habitantes vulnerables de Filadelfia. Las entregas a domicilio de alimentos gratuitos están disponibles para los residentes que enfrentan inseguridad alimentaria, que no pueden salir de sus hogares debido a alguna discapacidad. Este programa se da gracias a una asociación entre Liberty Resources Caring for Friends y Share Food Program. El programa comienza en mayo, pero usted puede empezar a inscribirse desde hoy. Para inscribirse, puede llamar o enviar un mensaje de texto al número 215-709-9619 o un correo electrónico a food@libertyresources.org. Un representante del programa le contactará para discutir el plan de entrega de alimentos. Gracias. Y esta es la actualización de materia de salud para el día jueves 23 de abril de 2020. Desde ayer se han confirmado 583 nuevos casos del coronavirus en Filadelfia y actualmente tenemos un total de 11.226 casos en la ciudad. En general, seguimos dentro del promedio diario de casos de la semana pasada. Tenemos 10 casos positivos del COVID-19 entre los internos, con un total de 59 casos registrados y 4 internos que se han recuperado satisfactoriamente. Tristemente, reportamos 20 nuevos fallecimientos en Filadelfia, con un total de 443 personas que han muerto por la COVID-19. 237 o 53% de estas muertes se han producido en hogares de ancianos. Este virus no discrimina por raza o género y los hospitales están monitoreando de cerca el aumento de los casos. 953 personas han sido hospitalizadas y 1.806 personas en la región sureste de Pensilvania. Observamos una pequeña disminución en el número de pacientes hospitalizados y esto es muy bueno después de varias semanas con un aumento en el número de los pacientes. El 31% de las camas en hospitales y el 26% de unidades de cuidado intensivo siguen disponibles en nuestra región. El Acura Center está operativo y está atendiendo a un número pequeño de pacientes. Y continúa la limitación en el número de pruebas disponibles debido a la escasez de hisopos para recolectar muestras y en la capacidad limitada de los laboratorios. Por lo tanto, se recomienda que las pruebas se apliquen solamente a personas mayores de 50 años y aquellas que presenten síntomas. Usted puede encontrar mayor información sobre los centros de pruebas en fiela.gov/COVID-19, pestaña FAQ. Estamos trabajando con los centros de salud federalmente calificados para ampliar el acceso a las pruebas para las poblaciones y vecindarios desfavorecidos. Estos centros están atendiendo a sus propios pacientes, pero han accedido en ampliar su atención a otros. Y hoy publicaremos información en la página web sobre 10 centros ubicados en muchos vecindarios dentro de Filadelfia. Las personas deben llamar y hacer una cita previa. Algunos comenzarán a operar el día de hoy y otros la próxima semana. Se mantendrá este criterio limitado para hacer las pruebas, solamente para las personas mayores de 50 años y para aquellas que presenten síntomas. Y estamos trabajando arduamente para conseguir más insumos para aplicar las pruebas, tales como hisopos, y para aumentar la capacidad de los laboratorios. Cuando esto pase, esperamos ampliar el criterio de la administración de las pruebas. Y todo indica que hay un avance muy lento. Sin embargo, todavía hay muchos casos. La mejor recomendación en estos momentos para prevenir la propagación del virus es seguir manteniendo la distancia social, porque el virus sigue circulando en nuestro ambiente. Si debe salir a trabajar o al supermercado, le recomendamos mantener una distancia social de 6 pies, usar máscaras de tela en lugares públicos donde sea difícil mantener las medidas de distanciamiento social, lavarse las manos apenas llegue a casa, y también le invitamos a consultar el sitio web para mayor información, www.fila.gov/COVID-19. Recuerde usted que puede llamar al 311 si tiene preguntas sobre el COVID-19. Hay servicios de traducción disponibles en 100 idiomas. Si tiene preguntas de carácter médico, puede usted llamar las 24 horas del día, 7 días por semana, al 1-800-722-7112, y esta llamada es gratuita. Muchas gracias.
Great, thank you, Armando. We're now going to move to the Q&A portion for members of the press. And again, we would like to ask our speakers to join us with their audio and video on. Please remember, we have limited time during these briefings, so only one representative from each media outlet is permitted for the first round. Reporters are asked to limit their questions to 3 or fewer. We'll do a second round of questions if time permits. For those who are logged in today, of course, you can use the raise your hand feature found under the list. First up today is Laura McChrystal of the Inquirer.
Hi, first a question for Dr. Farley on testing. With the city working with the health clinics to offer more testing at different sites, you've mentioned that materials continue to be in short supply. Is there any concern about having enough materials to expand testing to those sites, or fear that they may run out?
Absolutely. There's only so many, and we're concerned about that. We are working very hard to get more of them. And so we're supplying them as long as we have them. And if we continue to replenish the supply we have, we'll continue to have availability. We've told the federally qualified health centers that if we run out of supplies, then of course they can't offer the testing. But that's something we're going to continue to work on.
Okay. And another question for Dr. Farley about the contact tracing. I think you mentioned yesterday that the city would have to get somewhere below or around 50 cases per day to be able to do that. Are you anticipating, once you got to that point, how many city, health department employees would you need working to do that tracing?
We don't have a hard number, but it definitely would involve a lot of people. Now, there have been some very generous offers from other organizations to have their staff work on a volunteer basis to help with contact tracing. So we're seeing if that can be integrated into this so that it's not all a paid workforce. But clearly, there's an awful lot of labor involved in contacting 50 people per day and then contacting the people they may have exposed. So that's something we're going to work on now and hope to have in place when we get down to that threshold.
Okay. And as far as the governor's plan for reopening and the green, yellow, red categories that he laid out, do you anticipate Philadelphia kind of making tweaks to those guidelines, or could you expand at all on what additional challenges Philly might face as biggest city compared to the rest of the
Before Dr. Farley starts, it's not just Philadelphia, it's the entire Southeast region, which has similar density population. And we've been working together Chief of Staff's been meeting with the county commissioners every day by phone to discuss many things along with this. So, as I said yesterday, I believe, you could open a county in, Tioga, which has very few people, but you can't apply the same standards to the Southeast region in Philly. It's apples and cantaloupes.
I'll just add that the governor's plan is, paints things in very broad strokes. And I think that there's a lot of questions about what exactly would be in yellow and what exactly would be in green. And so we're going to be engaging with the state on this and try to figure out for this region what phases in at what point.
Okay, that's all from me. Thanks.
Thank you, Laura. Next up is Wendy Saltzman of NBC 10.
Hi, so this question is for Dr. Farley. Can you please tell me a little bit about where you guys are at on contact tracing? Has it started at all? Is that 100% necessary to open businesses and what we're looking at in terms of budget?
So we, in the beginning of this epidemic, when we only had a few cases per day, we were doing contact tracing. Now that we have 400 or 500 per day, we're not doing contact tracing. There is basic information given to people who have this infection to notify their contacts, but we're not doing any active follow-up ourselves. So we hope to soon, and I can't put a date on that, start contact tracing again, at least a fraction of the new cases that are being diagnosed. And as the number of cases go down, have that fraction increase to where we're eventually doing everybody. We don't have an estimate yet on how many people are going to be necessary. We don't have an estimate on the number of people. We don't have an estimate on budget yet.
Is this, do you think, necessary to reopen businesses? And back to that budget question, is there a budget in the city for it?
So it is necessary to do contact tracing for us to do a full reopen. I'm convinced that that's true. It is possible that some aspects may have reopened without having that entire contact tracing in place.
And the question is, if we have the money, we're spending a lot of money on our own. Hopefully, much of that is reimbursable. We're hoping that's the case, but we don't have additional just money laying around to be doing things or paying for things that should be paid for by the federal government.
Okay, and then my last question is, have you thought about, or what do you think about ideas like artificial intelligence being used in camera systems and heat sensors? Are those really viable alternatives to having boots on?
Let me just say there's been a variety of technology tools proposed that could help in contact tracing. I think some of them could be very useful tools. None of them are a replacement for people. They may make people more efficient and more effective. And so we're trying to come up with a plan now for how we use the combination of people and volunteers and tech tools to make this be as efficient and effective a process as possible. What that combination is, we'll figure out over time.
Thank you.
Great. Thank you, Wendy. Jack Tomzik of Metro is up next.
Hello. This question's for Mayor Kenny. So TWU Local 234 said you asked them to postpone their job action. What exactly did you say to them, and what did you do to put this off?
First of all, Willie Brown is an extremely decent human being. I believe that he has some medical issues in his own family that they're dealing with. So he understands the importance of nurses and doctors and hospital employees getting to work, and all of our essential employees. So we've had a really good conversation. He has members of his union, a large number of them. They're concerned about their own health, and we're trying to work through the issues. I don't think they want to go on strike or want to take a job action, but we have to work hard over the weekend to resolve those issues so his members are comfortable. And also, don't forget, his members are also driving the buses and the subway cars and the L cars and the regional rail. I mean, they're as frontline and as on boots on the ground as anybody in the group of essential employees. So we're working hard to get it done, and we're happy and thankful that they decided to give us some more time to work it out.
And I guess you probably saw their list of requests and demands. Do you think those are reasonable asks?
I mean, not everyone always gets everything they want, so we'll figure out what the happy medium is, and hopefully it'll resolve it.
All right, thank you.
Thank you, Jack. We're going to go to Kennedy Rose of the Philadelphia Business Journal.
What are you hearing from small businesses, especially those in the tourism and hospitality industries, and what are you hearing about them wanting to reopen?
They're suffering and struggling like everyone else, probably even more so because no one's traveling, no one's flying, and no one's booking hotel rooms. They're concerned about how they rebound, it's so far the unknown is the unknown as to when they can come back, when they can fully engage again. But we are in contact with them. We have, Welcome America and the Convention and Visitors Bureau, Convention and Visitors Board that we're in contact with regularly. I don't have an answer to your question because I can't read the future.
Alrighty, that was my only question.
Thank you, Kennedy. Go to Denise Clay of The Sun.
Hello. My questions are about new testing. Are there plans to partner with organizations that work with the African American and Latino communities in terms of this additional testing, and because of how those communities have been impacted?
The federally qualified health center sites are really serving disadvantaged populations, which in large part are minority populations in the city. We think that the best testing site is a site that has access to medical care. So when someone has a positive result, they can be directed in medical care if need be. And many of these people would be patients since they already have a medical record. There's also, if there's a testing site there, they can often bill insurance so that there's a way to pay for the cost of the test. We don't otherwise have a lot of dollars around to pay for the cost of the test. Having said that, we're happy to talk to anybody who's interested in testing, and within the limits of what we have, see if there's any way that we can work together.
Okay, that kind of answers my second question, which was, is there a cost for the testing? So you're saying basically that there is.
There's absolutely a cost of the testing, and there's some amount that the city can pay, but right now the city's budget's in trouble. So as much as possible, we want to have the cost of the test be paid for by health insurance. That's what it's there for, and that's a big channel of funding overall. So that's the way we're going to also be able to expand testing is financially.
Okay. Now, at the beginning of the beginning of the pandemic, there was a little discussion about health insurance companies and whether or not they'd be able to bear the cost for this testing. Because initially, everyone was okay. We'll help. But is that the same tone that insurance companies are taking now? As you get more requests for testing and more people with the coronavirus that require more care and have and in some cases more expensive care.
The health insurance companies are happy to pay for this testing. We had no problems with that. Obviously, it's only for their own members, but for people who are their members, they pay for this testing.
Okay. Thank you,
Denise. Thanks, Denise. Charlene Santiago of Univision, you're up next.
Sí, gracias. Mi pregunta va para el alcalde, ya que hemos visto y recibido varias imágenes de basura acumulada a través de la ciudad, específicamente en Kensington y Allegheny, algo que hemos visto previamente antes de la pandemia. Mi pregunta es si sigue habiendo un atraso con la recolecta de basura a través de la ciudad y si se han hecho algunas modificaciones desde que se anunció este atraso.
This is a question for the mayor. We have seen or received images of garbage that's been accumulating through sectors of the city, specifically in Allegheny and Kensington Avenues, something which we had seen before the pandemic. And we wonder if there's any backlog of the garbage collection through the city, if there's any modification that has been made to the delay in the services that the city had announced.
I will leave it to Brian Abernathy to talk about whatever the schedule's like. But I will tell you, and I've said this before, people need to understand that we're in this crisis situation and need to act accordingly and not trash our own neighborhood. We have to continue to think about these things, and we'll do our best to clean up and to get the trash picked up, especially even though our own streets workers, sanitation workers are on the front line. But we need a community effort, not the trash, and to help clean up and make the place tidy. But Brian, I don't know if you have anything for scheduling.
Armando, do you want to translate first, or do you want me to go?
Thank you. I'll do this one first. Brian nos va a hablar con respecto a la programación del recojo de la basura, pero yo lo he dicho anteriormente y quiero que la gente comprenda de que nos encontramos en una situación de crisis y que es importante que los ciudadanos cooperen y no estén echando basura en sus barrios y que piensen en mantenerlos limpios y en limpiarlos ellos mismos. Los trabajadores que están recogiendo la basura también están en la primera línea de respuesta y lo que se requiere es un esfuerzo comunitario. Go ahead, Brian.
So trash collection itself is not delayed, except on recycling weeks. We have seen some delays. This week is not a recycling week. The issues in Kensington and Aramingo are not collection related, but trash related and littering related. And we have crews going through that neighborhood, I believe 3 times a week, even during the pandemic, to try and clean the trash. But it quickly reaccumulates, unfortunately.
Quiero decir de que el recojo de la basura no está retrasado en esas áreas. Lo que está retrasado es durante las semanas que se hace el reciclaje. Y en el área de Kensington y Aramingo no hay problemas en la recolección de la basura, ni tampoco con la basura, sino justamente con la gente que está echando basura y está descartando cosas en la vía pública. Estos recojos se están haciendo hasta 3 veces por semana y les pedimos su cooperación con ello.
Perfecto, sería todo por mi parte. Gracias.
That's all for me. Thank you.
All right. Thank you, Charlene. Next is Natasha Brown of CBS 3.
Hi, thanks so much. Just a couple questions. Dr. Farley, just a short time ago, you talked about the fact that Philadelphia is certainly nowhere near the governor's yellow phase or any kind of reopening phase. And we were able to speak with him earlier on a conference call. And he definitely admitted that and said that Philadelphia in this region here would likely be one of the last areas to see any kind of reopening plan. Do you understand that? And what would you need to see happen? I know you said you have questions still just about all of this and how it would work. What do you think needs to happen before we even get into any of these phases?
Well, the governor's plan itself has a threshold number of cases per over a 14-day period before something region would be, if I understand it correctly, going to green. And that equates to roughly 50 cases per day. So right now we're over 400 cases per day. So you can get a sense for how much further we're gonna have to go in order to get to that level. As to whether there's things that can be done between here and there, that's something that's gonna have to involve through conversations between us and the other folks, our regional partners, as well as the governor's office. I do think that Philadelphia as a dense city, like other dense cities, is a much higher risk than other parts of the state. And so our timeline is going to be different from the rest of the state.
Thank you very much, Dr. Farley. Also, this is just about another story that we're working on in reference to an incident that happened at a DeBruno Brothers. Mayor Kinney, we're hoping to get your reaction on this. Just a woman that the police are looking for right now who spit on a customer and some employees there. In light of this pandemic and that kind of behavior, just your reaction about that case.
Well, obviously it's unconscionable and criminal, and we hope the police find her and get her someplace where she can't spit on anybody anymore. I mean, I think people start losing their minds a little bit, and I understand it's understandable, but that is an assault. That's to me an assault or an aggravated assault, knowingly doing that to make people ill potentially. So I mean, obviously it's wrong, and hopefully the police will find her and arrest her.
Thank you very much.
Natasha, are you all set?
Yes, thank you very much.
Thank you. And Aima Crespo of Telemundo, you're up next.
Mi pregunta es para Farley, es sobre los centros de pruebas en Kensington. ¿Cómo va a ser el proceso? ¿Para quién va a ser la prueba? Y si esta prueba va a ser gratis.
La última parte de tu pregunta, Yaima, si esta prueba va a ser gratis.
Sí, si va a ser gratis o si tiene un costo.
My question is for Dr. Farley. This is in regards to the testing center that are going to be opening in Kensington. What will be the process? Who will be tested? And if there's going to be a cost associated with this testing? So
that we hope to announce those sites next week. There will be no cost to the patient, although they're going to be collecting health insurance information and trying to charge health insurance. And there was a third aspect of the question. I forget what it was.
What was the
process? When we announce the sites, we'll announce the process. Probably there will be a phone number for people to call to make an appointment and go in there to get the test.
Queremos anunciar de que esto se va a hacer la próxima semana. No va a haber un costo, aunque sí se va a recolectar la información sobre el seguro médico que tenga la persona para tratar de recobrar ese gasto. Y cuando nosotros informemos de los lugares donde se van a abrir estas pruebas, también se va a informar sobre el proceso.
La siguiente pregunta es para el alcalde sobre cómo se está trabajando con las pequeñas empresas, con los pequeños negocios para este plan de reapertura.
My next question is for the mayor. How is work going to be structured with helping small businesses with their reopening?
Well, we have to continue to make progress on our medical side before we can get into that. We've done some grants for small businesses, and we're going to roll out, I think, 1,100 prior in the first round, I think 600 in the second round. But we do not have the resources to make whole every small business in the city without help from the state and federal government. We will pitch in as we can. We will give them advice and direction, and whatever money we can afford to give. But as far as the city shouldering the burden of all small business losses, it's not possible. We're going to have enough trouble meeting our revenue needs and our basic services going forward.
Nosotros vamos a continuar viendo este avance, según avance nuestro progreso en el campo médico. Eso es lo que lo va a determinar. Y estamos otorgando subvenciones. Se han otorgado en la primera ronda 1,100 subvenciones y estamos esperando otorgar 600 más. Pero nosotros no tenemos los recursos para poder tratar de recompensar las pérdidas que han sufrido los pequeños negocios en la ciudad sin apoyo estatal y federal. Nosotros podemos tratar de ayudar como podamos darle consejo y guía, pero cualquier dinero que se pueda dar se les va a transferir, pero la ciudad no puede cargar consigo sobre las pérdidas a raíz de esta epidemia, porque tenemos servicios esenciales a los cuales hay que atender y nuestro propio ingreso municipal se está viendo afectado por ello.
Muchas gracias, es todo.
Thank you, that's all.
Thank you, Yaima. And next we have Gray Hall of 6 ABC.
Okay, thank you so much. I guess the first question is, have we tracked cases of recovery? And if so, are those numbers available?
We are not tracking cases of recovery. We find out about them when they first are diagnosed, but we don't have an opportunity to follow up.
Okay, thank you for that. You kind of, Dr. Farley touched on this already, but has Philadelphia met the criteria under the governor's new plan to reopen? Everyone talking about that yellow phase, and how far away do you see Philadelphia? You kind of touched on this, but how far away do you see Philadelphia entering into that yellow phase?
We're definitely not at or near the yellow phase right now. It certainly will be weeks away. At how many weeks, I can't say. The virus really determines its own schedule.
Okay, thank you, Dr. Farley.
Anybody else, Mike?
Mike Dunn, you're unmuted.
All right, let me try that again. Gray, are you good? I think you are. And Martin Pratt, Billy, why at the end did you have a question?
Yes, I have a question. A couple of questions. This is to the mayor and Brian. The Department of Justice, William Barr, said yesterday that the stay-at-home orders are bordering on home arrest. Would like to get a comment from both of you.
Well, I'm not a lawyer. We have an extremely terrific city solicitor, and I will go by his advice and his department's advice. I really not a lot of common sense things come out of Washington every day. So I think the best thing we can do is just kind of move in our own direction, do our best to keep our people safe, get people better, and try to get people back to work. And what Attorney General Barr is saying, or what the president might tweet, we can't run a city or a region on that information.
Okay. The trash pickup, as far as on the ground and stuff like that, you mentioned that this is up to also neighbors and neighborhoods. Could there or will there possibly be some direction from the Department of Sanitation if we wanted to, as citizens, start to clean up our neighborhoods? That's one. And then two, we've noticed here in West Philly a lot of building owners or commercial properties that are not cleaning in front of their property at all. And so is there any kind of city response to the commercial property owners not taking care of their own properties?
Well, as far as Kensington Avenue is concerned, let me express again, we go through there 3 days a week and clean it. We pick up the trash there and pick up the recycling there. The things that I see on the ground generally are things that were in people's hands at one time and are empty and get discarded. That's what I'm talking about. So when you get off an L stop and you have a bag of potato chips and you just finish the last chip, throwing it on the ground is irresponsible. And if everybody does that, or a lot of people do that, it gets worse and worse. As far as the West Philadelphia issue that you raised, if we can get some offline addresses of commercial properties that are untidy and need attention, we'd be happy to have somebody look at that and either issue the appropriate citations or try to figure out a way to get clean.
Yeah, and Martin, I just want to add that our community partnership program is still up and running. That provides tools, trash bags, gloves, etc., for communities to pick up litter, and then makes arrangements to pick up that litter at the end of the event. So happy to get that information back to you to print in the community. And then just to echo the mayor, if we have addresses or areas, happy to make sure that sweep officers go out and write appropriate citations.
Okay, thank you. Lastly, New York has at 7 p.m. they're doing celebrations every day for our frontline workers and the healthcare workers. Is Philly gonna, the city gonna get behind that or come up with its own Philly flavor thing that we do for our healthcare workers? Because I feel like every day I'm seeing New York, and I know we've got more Philly,
You're going to see New York all the time because it's New York. And I mean, the governor of New York is on TV more than the president, and thankfully, because he's one of the few people speaking sense. But as far as we've done some lighted buildings in an effort to lit the bridge and lit the center city buildings blue. I think that New York thing kind of happened organically, and sometimes it's hard, to have an organized, natural thing happen. Certainly, if somebody has some ideas, we'd be happy to vet them and see whether or not we could do something. And New York and Philadelphia are the same, but they're different. And
gotcha.
I'd be happy to take it. Any ideas that would give us a pump up or a lift, certainly happy to listen to.
Thank you.
And just to be clear, Martin, every Tuesday night we are doing something. I believe it's at 7:00 as well. So spread the word. And I think, again, that was a little bit organic in New York City. It certainly wasn't government sponsored. It shouldn't be government sponsored. It should be something that is really run from our civic pride. Because the work that our frontline workers are doing, from the healthcare workers to our public safety folks to the folks working in our restaurants, is tremendous. And we as a community should be showing the support for them.
Thank you.
Martin, did you have any other questions? You're good? Okay. This is the last call for questions. Gray Hall of 6 ABC, I want to go back to you. I wasn't sure if you were finished.
Okay, thank you so much. My question, I guess, is maybe for the mayor. Has there been any furloughs with city employees?
No.
No furloughs. Okay, and
Brian,
last question.
Brian, could you just confirm? I believe no. I believe no, but just Brian, you could confirm.
Yeah, no. We're still working through our budget issues, and but nothing to date.
Okay, thank you guys so much. And the last question for Dr. Farley from producers. They wanted to talk about the numbers. The mayor says reopening plan would be, I think, 50 new positive cases with the virus per 100,000 residents. In terms of those numbers, I think you said we average about 500 cases a day. Where do we stand with the numbers from the governor? And again, they're asking about, I guess we won't be in that 2-week range of hitting that yellow zone.
I think it's extremely unlikely that in 2 weeks we will be below 50 cases per day in Philadelphia.
Okay, thank you so much.
All right, thank you, Gray. And finally, at least at the moment, is Pat Loeb of KY.
Yeah, I just want to clarify. Gray just said 50 cases per 100,000. Philadelphia would already be there if that was the case. You're talking about 50 cases total, new cases a day, right, Dr.
So 50 cases per day is what I'm talking about. The governor's plan, I forget the exact number, but I did the math and figured that that is expressed as the cases per 100,000 over a 14-day period. That ends up translating to pretty similar to 50 cases per day in the city of Philadelphia.
Okay, thank you.
You good, Pat?
Yes, thanks.
All right, and seeing no other hands raised, thank you for joining us. That concludes today's daily briefing. We will try this again tomorrow at 1 p.m. and go Eagles.